What are three practical tips that you can give our listeners to help them advocate for hereditary cancer testing?
I think the first thing, advocacy begins at home. I think it's having the open conversations. We can no longer live in the time where our business, keep our business, what stays, what happens at home stays at home, keep our business private. Yes, some information definitely should be kept within the household, but information around family health history and diseases and conditions, that information should be shared. And it's not a one time conversation, it's an ongoing conversation. And it's not just cancer, it's diabetes, it's heart disease, all of mental health conditions that can run in families. I think that's important. That's where advocacy begins. And as a mother, the best information that I can give my children is their knowledge on their family health history. Rome, my genetic results are in my will. If I die
Mm,
today, my children are young, but that information is written into my will because I don't need an additional barrier for them as they go into the healthcare system, right? That's the greatest gift that I can give them as it pertains to their health. I think
mama.
another factor is not only talk about these conditions, but remove the stigmas around these different conditions. I think it's important to create a space where people can, when we're talking about family health history, where they can talk openly about mental health conditions and other conditions in a safe environment and not feel shamed. And none of those that costs nothing, right? I want to acknowledge that as a woman in this space, that there's certain access and privileges that I've been able and blessed to have, but those things cost nothing. And I think the last thing is our voice. Another thing that costs nothing is our voice. It's being able to, if you feel something is wrong or it's off, stand up, say something.